My name is Peter Kokkinos. I'm from the Veterans Affairs Medical Center in Washington, D.C. and Georgetown University School of Medicine. There is strong evidence that statin use increases the incidence of diabetes in at least some populations. That increase is approximately 30% based on the latest trials. However, because of the benefits of statins outweighing the risks, statin use is not about to decline in the near future, and therefore it is desirable that we find ways to attenuate that statin-induced risk of diabetes. What are some of the ways? Well, we do know that lifestyle interventions, particularly physical activity, lowers the risk of diabetes incidence. The question, of course, is does physical activity or increase of physical activity, improvement in cardiorespiratory fitness, does it also lower the risk of diabetes in patients who use statins? For this, we identified 4,000 hyperlipidemic patients who were on statins and 3,000 who were not on statins. And when we looked at all these patients had an exercise tolerance test, and based on that, we defined the quartiles of fitness, and we stratified them based on that as low fit, least fit, low fit, moderate fit, and high fit. When we looked at when we performed Cox regression analysis to look at the hazard ratios that is associated with the MET levels as a continuous variable, and that was what we found was that for every MET level increase, there was a 6% reduction in the risk of developing diabetes. When we stratified the cohort and based on the fitness level, and we introduced the cardiorespiratory fitness variable into the model, we found a progressive decline in the risk of diabetes as fitness increased. Then we compared the statin cohort with the non-statin cohort, and using the non-statin cohort as the using the statin cohort as the reference group. In this model, what we observed is that the increase in risk, 50% increase in risk, was associated with the lowest fitness category and 22% with the next to that lowest fitness category. And there's no risk associated with the moderate and high fitness groups. We went one step further, and because we divided now the non-statin cohort into fitness categories to specifically look at the non-statin low fitness compared to the rest. So when non-statin low fitness group was used as a reference, we saw again the same trend, higher incidence of diabetes in the low fit, the very low fit group using statins, but the risk was abolished for other categories. So the take-home message here is that yes, statins do increase the risk of diabetes. In our population, was 24% higher in the statin group versus non-statin group, and fitness attenuates that risk.